Needing attention, eye bags and drooped eyelids. Hello all. At 49, I finally had the time to rejuvenate the skin around my eyes. I'm new to the surgery scene, but I've wanted my eyes to be done for many years. I would like to ask what the best procedure is for me to have a natural looking result with no eye bags or droopy eyelids.
Thank you for your question. You submitted your question with several photos, and you state in your question that you're 49 years old and that you finally have the time to address the appearance of your under eye area, that you're new to the surgery scene and you'd like some guidance as to what to do to help the puffiness and droopiness of your under eyes. Well, I can certainly share with you some basic concepts that I discuss with my patients who have very similar situations, and I think it's very important with your unique anatomy to understand some of these principles which can often be overlooked. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Helping people with the under eye area has been a very important part of my practice. And in fact, as a cosmetic oculofacial plastic surgeon and specializing in aesthetics, I also do a lot of revision eyelid surgery for complications. And I think that your anatomy is something that you should just be mindful of in determining the best strategy that's right for you. And I'll go further as to what I mean. So to begin with, when you look at your eye structure, it's very important to understand that the under eye area has many important anatomic elements that need to be balanced in order to maintain a natural shape and maintain function and to avoid a lot of the problems that can occur. So to begin with, let's start with first defining what some of the issues are. And it's important to also understand when you look at your under eye area that you can also look at the under eye area as it relates to the cheeks. You know, when people come to me and want to help their appearance under their eyes, very often they look so intently or are so focused in the eye area, they miss part of what's surrounding that area. And so what I try to explain is that when you look at someone's eyes, you also look at their cheekbones. You look at this whole area. And it's important because there's a harmony that can be potentially achieved by managing both areas and not just isolating the work under the eyes. But there are some key principles to understand. For one thing, your eye is relatively prominent relative to the cheekbone. Now, with facial aging, cheek volume diminishes and the eye socket changes. And this is due to bone loss. And so it's a very important variable because when you perform eyelid surgery, you want to ensure stability of the eyelid position. That being said, let's begin with the first issue of what helps people look better under their eyes, and that has to do with something called lower eyelid fat prolapse. What this means is that the fat pockets that are around your eyes pushes forward and creates a bulge of fat. With someone with prominent eyes and someone who's male, I generally do this procedure from the inside, and the procedure is called a transconjunctival blepharoplasty. What this means is that the fat pockets that are underneath the eyes are reduced from the inside of the eyelids. Now this is very important because the key here in your situation would be to maintain the support under the eyes of the muscle, like the orbicularis oculi muscle, which is acts like a hammock to hold up the eyelid. It is not unusual for a lot of doctors to perform this procedure from the outside with the intention of removing skin to try to help people improve the appearance of excess skin or the appearance of wrinkles. Unfortunately, that can result in complications such as what's called ectropion or lower lid retraction. And that's something that I would caution you about given your anatomy. Further, with the under eye area, and this is only with the physical examination, you have to determine this, but it's also important to deal with something called lateral canthal tendon laxity. When I look at your eyes, it looks like the tendon that helps support the lid may also need reinforcement. And so that's something that also has to be addressed. It's also possible that you may need some support under your eyelids, which means additional structural support to help the position of the eyelids. So it's not so straightforward as just doing something that's cookie cutter. Further, just to finish the thought about the cheekbones, there are times when there's a value in helping create volume on the cheekbone. Now this can be done with a technique called structural volumizing, and this is a procedure where we use a long-acting filler such as a Juvederm Ultra Plus or Juvederm Voluma, and we can do that at the time of surgery to enhance the cheekbone to create a balance and harmony that helps the eyes look better. So I think it's important that you meet with qualified, experienced cosmetic surgeons, and I would add to it that you consider choosing an oculofacial plastic and reconstructive surgeon because of this super specialization on the eye area and familiarity with the complexities of balance of the lower eyelid that I think are particularly relevant in your situation. So learn more about your options, do your research, come to your consultations with a good list of questions, and see where you're comfortable, and then proceed. Certainly there is a lot of choices, but you want to be sure, most importantly, that your procedure is done in a way that maximizes the integrity and the function of your lower eyelids, in addition to improving the aesthetics. So I hope that was helpful. I wish you the best of luck. Thank you for your question.